Hey there, friends. My name is Kelsey. I'm a team member here with Sarah Michelle in NCLEX Review. And today in this video, we will be discussing blood product administration, which is an important topic to know not only for practice, but it can also show up on your board exam. Now, I know this topic can be a little bit intimidating, but everyone take a deep breath because we are going to show you how to break this down step by step. So to start off this video, I want to review blood types and compatibilities. NCLEX most likely will not get into the nitty-gritty specifics of this, but I wanted to throw it on a slide so you can see exactly who can receive which kind of blood. Remember, you have 4 different blood types: A, B, AB, and O. You also need to know your client's RH factor, which is telling us if they are positive or negative. You can see here we have a universal donor and a universal receiver. This means that anyone who is AB positive can receive any type of blood product, whereas anyone who's O negative can donate to any blood type. I would say the big thing to note here is that you always want to make sure that the donor blood matches your client's blood type. And then we absolutely need to know if our client is RH positive or negative. Now, what are some reasons we may be giving a client blood? Well, the most obvious reason is blood loss, right? And this can be from trauma, surgery, or even childbirth. And then we may even be using blood products for our clients who are severely anemic. Okay. Remember that NCLEX will give you those normal lab values, but I want to talk about some lab values here because this is important to remember when we get into practice. For males, we want our hemoglobin to be between 14 and 18 grams per deciliter. And for females, we want it between 12 and 16 grams per deciliter. Our hematocrit for males, we want between 42 and 50%. And for females, we want it between 37 and 47%. It may be easier for you to group them in your head for memory purposes, but please remember that there are different values depending on the sex of the client. Then we also need to look at our red blood cell count, and we want that between 4.2 and 5.9 cells per microliter. So now that we've covered some basics, we can get ready to start the blood transfusion. The first thing you are going to want to do as a safe registered nurse is to check your hospital's blood transfusion protocol. Most hospitals do require 2 RNs to verify blood product administration, and this policy will vary hospital to hospital. Next, you are also going to want to make sure your client has signed a consent form. A consent form is that legal document that shows that the provider has discussed the risks and benefits of a procedure with a client, and that client agrees to the procedure. We cannot start a blood transfusion until we know the client has given consent. Now, can you remember what group of clients typically do not allow blood transfusion? If they're Jehovah's Witness, that's right. Next, you're going to want to make sure your client has a type and cross documented in their chart. This ensures you have the right blood type to transfuse. The blood bank will match the blood so that it's compatible with your client. This is not something that we are going to do as a nurse. However, it is important to remember that you are the one who double checks and verifies that you have the right blood for the right client. This must be done with 2 RNs. We are this last set of eyes before starting a transfusion. The blood bank will also prepare all needed units of blood depending on how many units the provider has ordered. Remember, you can only transfuse 1 unit at a time. Finally, you are going to ensure you have a patent IV. Do you remember what gauge we need here? It's that 18 gauge IV. We need that larger size IV in order to be able to effectively transfuse packed red blood cells. Friends, this is so important. You do not want to be stuck trying to restart an IV once you have already picked up your blood from the blood bank. And why is that? Well, remember you only have 30 minutes to get that blood running once it comes out of the refrigerator from the blood bank. Okay, before you get the blood, make sure all your supplies are ready. Because remember, how long do you have to get that blood started? 30 minutes from the time it leaves the blood bank. Okay, so what do we need? You need that patent IV, wide tubing, and normal saline. We also need to grab those baseline vital signs, including a heart rate, a blood pressure, a respiration rate, and a temperature. We will be monitoring their vital signs closely throughout the transfusion in case our client experiences a transfusion reaction. Once you get your blood, as the safe registered nurse that you are going to verify the 7 rights of medication. And let's review those 7 rights. Right drug, right dose, right time, right route, right client, right reason, and right documentation. We check this with every client every time. Now, we needed to get the transfusion ready. The first step is to prime your Y tubing with the normal saline. Then you are going to run your blood over an infusion pump very slowly for the first 15 minutes. While that is running, you are going to stay with your client for those 15 minutes and document vital signs every 5 minutes for those first 15 minutes. We are also staying with our client to make sure they do not have any type of reaction. Once we have watched our client for 15 minutes, we can go ahead and increase that rate to what the provider has ordered it to run at. And then we are going to document another set of vital signs at that 15-minute mark. After that, we can check their vitals hourly until the transfusion finishes. Now remember, 1 unit of blood has to be transfused in 4 hours or less. Let me say that again. You have 4 hours to get that blood transfused from the time it leaves the blood bank. Make sure you know that. Okay, let's pause here and do everyone's favorite, a select all that apply question. The registered nurse has started a blood transfusion on a client who experienced hypovolemic shock secondary to a motor vehicle accident. 1 hour later, the client experiences an anaphylactic transfusion reaction. What signs and symptoms might the nurse see in a client who is having an anaphylactic transfusion reaction? Select all that apply. And if you need a minute, you can absolutely pause this video. If you selected A, D, E, and F, you would be correct. Before we break this down, let's briefly discuss a few different types of transfusion reactions that we may see. We could see an anaphylactic reaction, like in this practice question, but we could also see a febrile reaction, where our client may have chills, malaise, and of course, a fever. We might also see a hemolytic reaction, which occurs when there has been an incompatibility of blood products from the donor to the receiver. In this type of reaction, our client may complain of back pain, or they may have some dark urine. We have to be really careful with this one because this can actually lead to DIC. Okay, back to our practice question. First, we have angioedema. Angioedema is another term for swelling, and this is life-threatening because this means that our client's airway is at risk of swelling. Angioedema is one of those big red flags that you are dealing with an allergic transfusion reaction. Next up, we have bradycardia, or a low heart rate. If someone was having an allergic reaction, we would actually expect to see tachycardia, or an increase in heart rate. Next, we have hypertension. Hypertension does not occur during a transfusion reaction. Instead, we would expect to see hypotension, or low blood pressure. And this happens because during an allergic reaction, our blood vessels expand, which causes that dangerous drop in blood pressure. Urticaria is another word for hives, and this can lead to itching in our client. Remember that NCLEX may use other words to describe something, just like here. Itching is definitely a sign that a client may be experiencing an anaphylactic reaction. Finally, we have wheezing, which is absolutely something we could see if anyone is experiencing an allergic reaction. Okay, I'm going to give you a little mnemonic to remember those different signs and symptoms of a transfusion reaction, and that's just simply the word reaction. R for rash, hives, or itching, E for elevated temperature, A for aches like that backache, C for chills, T for tachycardia, I for increased respiratory rate, O for oliguria or low urine output, and N for nausea. Now, what are we going to do if our client has any type of transfusion reaction? The first thing we are going to do is stop that transfusion immediately. Friends, listen up here. The number one priority is stopping that transfusion. Then we can notify our provider immediately while we disconnect that transfusion set. But remember, we are going to keep that line open with the normal saline in case we need to use it later on. Next, we are going to send that blood and tubing back to the blood bank for them to repeat the type and cross to see what could have caused that reaction. Okay, let's tie this all together with a little case scenario. You have a 25-year-old female client who presents to the emergency department with concerns of fatigue and weakness. She states that when she woke up this morning, she fainted. Her past medical history includes hypothyroidism and iron deficiency anemia. Her vital signs are as follows: a blood pressure of 102/62, a respiratory rate of 16, a heart rate of 103, and a temperature of 98.4. The provider orders a CBC, and the results include a hemoglobin of 5.2 and a hematocrit of 34. The provider orders 2 units of packed red blood cells to be transfused. What are the steps the nurse needs to take to prepare the client for a blood transfusion? I know you guys can get this one here. So first, we want to gather our supplies. We want to start an 18-gauge IV, and we need to make sure we have that Y tubing and normal saline. And then finally, we want to ensure that that client has signed an informed consent. In addition, make sure you have your second RN verify that you have the right blood product for the right client. Okay, let's continue with this case scenario. Due to the high volume in the ED, the registered nurse cannot locate another RN to verify the blood product. The nurse decides to start the transfusion and will have another RN verify when one becomes available. Okay, pause. I want to point out that this is a real-life situation that you can absolutely find yourself in once you start practicing as a nurse. However, we must be safe nurses and follow protocol always. Back to our scenario. Once the nurse starts the blood and remains with the client for 15 minutes, she notes the client's vital signs to be within normal limits. The nurse then increases the transfusion rate to the provider's orders and leaves the client since vital signs are stable. An hour later, the nurse returns and gets the following vital signs: a blood pressure of 92/54, a respiration rate of 16, a heart rate of 95, and a temperature of 101.2. While in the room, the client tells the nurse that she is experiencing a mild backache that just started about 10 minutes ago. What should the nurse do next? And if you need to, go ahead and pause this video. Okay, I know you got this one. The answer is D. We want to stop the transfusion first before we do anything else. Now, if NCLEX asks a question and one of the answer choices is to call the provider, that is likely not your first choice answer. NCLEX wants to ensure that you are a safe registered nurse, and the safest thing you can do first as a nurse in this situation is to stop the transfusion, and then you can call your provider. The nurse then contacts the provider, who states she is on the way for further assessment. When the provider arrives, she notes that her client's blood type is A negative. However, A positive blood is what was given to the client. The provider notes that the client is experiencing a hemolytic transfusion reaction due to receiving the wrong blood type. Now, acute hemolytic transfusion reaction has a triad of symptoms: fever, flank pain, and red or brown urine. However, this classic presentation is not often seen. Other symptoms are chills, hypotension, renal failure, back pain, or signs of DIC. I wanted to include this case scenario to show you how quickly a situation can escalate just from making a mistake. And that is why the 7 rights are so important, and why we must double check to make sure we have the right client with the right blood type. Okay, friends, here are some key takeaways to keep in mind for NCLEX. The blood must be started within 30 minutes after receiving it from the blood bank. You have 4 hours to complete the blood transfusion. Make sure you follow your 7 rights of medication administration even when giving blood products. And if you suspect a transfusion reaction, stop the transfusion immediately. And that's a wrap on administering blood products. You are one step closer to becoming a real deal registered nurse. Thanks for joining me today, friend, and we hope to see you back here with another content video. Be sure to hit subscribe so you don't miss our newest videos. Happy studying!